treatment is using BSI and aseptic technique. Patient is being oxygenated via nasal cannula at high flow. Patient height is 175 centimeters, which indicates the number 4 red-sized airway. Cuffs are inflated to 60 milliliters and examined for leaks or tears. Responder confirms that the selected airway is acceptable for use, deflates the cuffs, and applies a water-based lubricant, making certain not to intrude upon the ports. Responder also prepares a secondary airway in case of equipment failure. The patient's head is placed into the sniffing position, and with the non-dominant hand, the mouth is held open, applying a chin and tongue lift. The king is introduced to the mouth at 90 degrees and advanced without excessive force. As the tube advances past the base of the tongue, it is rotated to the midline. The number 4 king is inflated to 80 milliliters. To ensure full inflation, pressure is maintained on the plunger until the syringe is removed from the valve. The airway is gently pulled back to ensure that it is sitting in the ideal position. A bag valve device is attached to the opening port, and the medic observes effective bilateral chest rise. Ventilation is continued by assistant. In this video, however, the bag valve is moved off scene for demonstration purposes and for lack of personnel. The effectiveness of the king airway confirmed. The medic notes 13 centimeter depth of extruding device and secures it in place with string or tape. If consciousness is completely or partially regained, the airway is immediately deflated and the patient is returned to a semi-Fowler position and encouraged to cough. The airway is removed in an anatomically congruent fashion.